Dr. Alexander, thank you for joining us.
Thank you. Thank you for asking me.
You were president of the AAHPM in 2000?
Coming into the new century.
Wow.
A change.
Yes. Tell
Yeah.
us about that year a little bit.
That was, well, it was the turn of the century, so we were thinking of big things, but what was important about it was that it was the first year that we had a competent management company to work with. And I think it was difficult for me because I felt personally I had to rein in some of the things that I'd like to do because we didn't have a lot of money. But we had an outstanding executive director assigned to say how we should move forward in order to make sure that we existed in the future.
Now, were you working with Dick or Ann mostly?
Dick. Yeah. Dick was, that was his first year.
Okay.
And the hard thing for me was that he said, basically, all the things that you all think are important are very important, but you can't do them because you don't have the money. You're looking out here, and my job is to look right here and make this a sustainable organization. And so my challenge was to try to walk a balance among the members to try to explain why we may or may not be doing certain programming. But I felt like Jim Palmer wrote about being a level 5 leader, and that was what I thought, oh, it's for the good of the organization. So that's what I felt like I had to do. And I think that probably I spent more time that year listening to people from all over the country talking about their concerns about where the academy is going and how, whether it was going to be there in the future to support all of these things that we all were interested in, education and, you know, durable materials,
Yeah.
all those things. Yeah. So I don't feel like in that year that we were able to accomplish a lot in terms of programming, but we actually were able to get our budget under control and have it available to the people going forward. So it was truly a new organization by the end of the year. And so I suppose that's an accomplishment of sorts.
I think so. You've certainly seen some changes between then and now. How do you see the Academy's strengths and challenges?
I'm so impressed with this meeting because we're seeing the fruits of some of the research that's being done by young investigators, and I think that that's incredible for the field. And we found, thankfully, that most of the things that we actually believe were true are true, and finding some things that probably we could work on more. But the challenge is, because we're an organization of hospice and palliative care physicians, the challenge has always been how to hold that together and how not to err on one side or the other such that we don't offer the kind of education and support that we need for both kinds of physicians. And I think that people who do academic research clearly are for the most part in academic institutions, and thus they're not necessarily working directly with hospice programs. And I think that some hospice physicians who don't have access to that environment may feel that we're not pursuing enough in terms of research related to hospice. Now, clearly, Gene Kuttner and that whole research group have focused on hospice needs and issues. But I think what we need to do going forward is to promote both of those areas and how to bring them together better. You know, it's really easy when you're in an academic institution to do navel gazing. I mean, to just, because you have to ask really specific questions, very tiny questions, and approach them incrementally. And yet, we need health delivery services kinds of research just as much as we need some of those more focused types of issues.
You've spent a lot of time overseas and have a sense of the international perspective. How do you see hospice and palliative medicine from that perspective?
Yeah, I've spent about the last 7 years out of the country completely. And it's been clear, what's most clear to me is the lack of evidence of activity from the United States. Clearly, there are individual hospice programs that have partnered with individual hospice programs, and there are a few groups of people who have gone different places to teach, you know, and form partnerships, but there's no real commitment, probably a lot of it reflecting the economy right now, but there's not a lot of reflection outside the country. People don't realize what we're doing in this country, and I think that that's a significant area that needs more attention. There are really active hospice and palliative care organizations in almost every country now, and they desperately are looking for experts to help them, to mentor them, you know. And where are we? It's the European Hospice and Palliative Care Organization and Canadian, you know, and we're not there. And I know that people think of it as being a major expenditure, but we don't have to go there. You know, we can do distance learning. You know, there are lots of things that we could do that would really give a lot of support. And one thing I noticed when I came to this conference was that the membership stipends to help physicians who can't afford to come to the conference are only for people in the United States. That's understandable, but we need to do the same thing for people outside. And clearly, we have a budget and we have to cover lots of things. And I'm not saying that the money to do that should just come from the academy, but we have to think of ways to offer more support to those physicians. There are quite a few African physicians at this meeting right now, but
we brought 6 or 8.
yeah, but we need 6 or 8 more because they're big countries.
Yeah, that's right.
Yeah. The other way that I think that we could be more helpful is to, and this is what I've learned from doing international work actually, is that to be more cognizant of the steps that people have to go through in order to be able to do good palliative care. You know, that even in this conference, it's not really labeled things for beginners, intermediate, you know, more advanced. And we're in a place now where we have older physicians saying, there's nothing here for me, you know, and great things for new people, but in the international setting, because most people have never had any teaching about psychosocial, emotional, spiritual aspects of care.
Right.
That's brand new. So you need materials and mechanisms for teaching about those things from the very beginning.
Yeah.
You know, that seems reasonable. Makes sense. Yeah.
Looking forward, what kind of characteristics do you think our future leaders are going to need?
Well, I think mostly they need to be extremely bright, as they all are, very flexible, and primarily able to think out of the box, and to not think that they have to just pick up what we have now and say this is how it's going to be going forward. I mean, there are lots of people who are more interested. We've had an impact because there are people who are interested in patient-centered care, you know. So how do we partner better with those people? And how do we say, we have expertise here that we'd be happy to share with people, you know, and you can teach us something too, without losing our identity, you know. But I think they have to be flexible to be able to do that and recognize that I spend a lot of time teaching. I teach first-year medical students history taking. I teach third-year medical students introduction to palliative care. I teach African students, doctors and nurses, introduction to palliative care. And I'm very aware that each of those requires a separate vocabulary. And each of the organizations that we need to interact with has their own vocabulary.
Yeah.
And we need to be particularly focused on how do we meld those things together so that we're really doing something for patients and families everywhere.
Anything else you want to add?
I guess the other thing I was thinking about is that over the past 10 years, we have achieved becoming a medical specialty, which is, for all of us who've been through it from the beginning, a huge achievement. But we can't stop there because that's really not what the goal was. The goal is to improve care for patients and families dealing with serious illness and near the end of life, and for people who grieve those people. And we have to step back and look at what proportion of our programming and our thoughts are we putting into each of those aspects. Because I think we've spent all our energy on becoming professionals, you know, and getting recognized. So been there, done that, you know, you can never, it's always, what have you done for me lately?
Right.
You have to move on to something else. And my two concerns that I've heard in this meeting are the dissolution of a major hospice program that has trained a significant number of people, not to mention the number of people they've cared for dying. That's got to be on the front page because that's a big hit to our industry, you know, and somebody has to pay attention to that. We have to have a good response, you know, and where are we going to go from, you know, what are we going to do about that? You know, that's not minimal. And the other one was, well, I guess I said the other one is more the international thing that I think reaching out to other countries and you know, there are wonderful researchers all over the world who don't even think about looking at stuff from the United States because material from the United States because they think that we have this Medicare hospice benefit and we're different and we don't really do palliative care the way they do because we define it differently than anybody else. You know, I think now that we know who we are and we have our profession, now we really need to get out there and do something about it.
Thank you so much for your past and continuing leadership.